Buddhism and Mental Health, mindfulness-based therapy for anxiety and PTSD patients. This is with Matt Stamp, Bill Wright, Valreet Kaur, Jingjing Zhu, Nora Rice, and Bahar Holzheimer. CM 740 with Dr. Seong Choi. Founded by Siddhartha Gautama in the 6th century BCE, born a prince in what is now Nepal, he abandoned his life of essential indulgence at age 29, embracing the other extreme of being a wandering ascetic, searching for the true root of suffering and how to overcome it. After 5 years, he sat under a Bodhi tree for 49 consecutive days of meditation until he finally achieved enlightenment and became the Buddha, or the Enlightened One. Buddhism is followed by more than 500 million adherents worldwide, making it the fourth largest religion. While it is usually called a religion, it is also considered a philosophy or even a psychology focused on suffering, its cause, and how it can be made to cease. Four Noble Truths: Suffering and the Way to Cease Suffering. The core of the Buddha's teachings is contained in the Four Noble Truths, which was the Buddha's first teaching following his enlightenment. These are: number 1, the truth of suffering or discontentedness, dukkha, that in life there is suffering. Number 2, dukkha is caused by the three poisons, samudaya, attachment, aversion, and ignorance. Number 3, there is a path to liberate and let go of suffering to end it, nirodha. And number 4, the Eightfold Path is a way to liberate and let go from suffering, magga. This means you have to have right morals, behaviors, and actions that do not generate negative karma. The Noble Eightfold Path, the prescription for attaining the goal of liberation from suffering. This refers to the interconnected dimensions of a person's behavior necessary for developing and maintaining wisdom, moral discipline, and concentration of the mind. Number 1, the right view. The right view of nature of mind and the Four Noble Truths. Right intention. The intention to avoid the three poisons. Right speech. Speaking in a way that refrains from lying, divisive speech, harsh speech, and senseless speech. Number 4, right actions. Actions that avoid physical misdeeds for the body like killing, stealing, and sexual misconduct. Number 5, right livelihood. Avoiding trades that harm people and animals, and to avoid taking intoxicants. Number 6, right effort. Abandoning negative states of mind that arise and yet to arise, and sustain positive states that have yet already arisen. Right mindfulness. Awareness of breath, body, thoughts, emotions, sensations, and anatta, the non-self, the no-self. Number 8, right concentration. One-pointed concentration. The result will be understanding of the Dharma and bring it into your life. Buddha is a psychotherapist. Basically, the Buddha was the world's first psychotherapist. He identified a mental illness, dukkha, diagnosed the root cause of the illness, samudaya, determined that there is a cure for the illness, nirodha, and wrote out the prescription, ariya magga. Buddhism's main goal is the cessation of suffering through cultivating one's understanding of the root of that suffering. Develop practices which further that goal, including teachings and a holistic lifestyle system that can support attainment of the goal. Analysis of our thoughts and behaviors and how they color our experience of life is necessary if you are truly to relieve suffering. Therefore, all the major strands of Buddhism employ various mindfulness practices to develop the practitioner's ability to maintain mental balance. Mindfulness meditation. Mindfulness meditation is a key practice to understand how the mind works. We learn to take in each moment as it comes, fully aware of them, without judging, holding, or otherwise interfering with our processing of them, thereby developing self-awareness, personal responsibility, and ability to make skillful choices. There are 4 core foundations of Buddhism mindfulness meditation: mindfulness of the body, what is being perceived by the senses in the moment; mindfulness of our feelings, how do we feel about what we are perceiving; Mindfulness of our thoughts. What emotional reactions are we experiencing based on what is being perceived? And mindfulness of external phenomena. What is the nature of our perception? Common anxiety and PTSD symptoms. Some anxiety symptoms might be psychological arousal, like fearful anticipation, irritability, and worrying thoughts. There could be anatomical arousal, like gastrointestinal issues, like epigastric discomfort or difficult swallowing. There could be respiratory issues, like difficulty to inhale, cardiovascular, like heart palpitations, and genital urinary, like frequent urination, erectile dysfunction, or amenorrhea. There could be muscle tension, causing headaches or achy muscles, hyperventilation, like a feeling of breathlessness, and sleep disturbances like insomnia. For PTSD symptoms, there could be intrusive memories, avoidance behaviors, negative alterations in cognition and mood, exposure to traumatic events, and hyperarousal. These can be triggered by a wide range of stimuli and re-experiencing the trauma, even and especially when not really in the original situation. These symptoms represent suffering. If no definitive physical cause of these symptoms, consider that the real cause of the suffering might be found not in the physical world, but in the poisonous thought patterns identified by the Buddha: ignorance, attachment, and aversion. Buddhist approach to general anxiety disorder and post-traumatic stress disorder. Buddhism offers various practices that can help address both GAD and PTSD, including mindfulness meditation to cultivate present moment awareness and reduce dwelling on past traumas, which can't be changed, or future worries, which may never happen. Loving kindness, metta. Metta meditation to develop self-compassion and reduce self-blame, often associated with anxiety and post-traumatic stress disorder. Insight practices to gain deeper understanding of the impermanence and interdependent nature of all phenomenon, potentially reducing attachment to fixed outcomes or identities. Breath awareness and body scan techniques to ground attention in present physical sensations rather than anxious thoughts. And contemplation of the Four Noble Truths to understand the nature of suffering and the path to its cessation. Buddhism influenced Western psychotherapies. Several psychotherapies have been developed in the West that incorporate some or all of the above practices, generally secularizing them to make them more acceptable to Western patients. We will introduce three such therapies: cognitive behavioral therapy, CBT, mindfulness-based stress reduction, MBSR, and mindfulness-based cognitive therapy, MBCT. Common elements of these psychotherapies include integrating mindfulness and compassion practices into the therapeutic process to varying extents and objectives. Cognitive behavioral therapy, developed in the 1960s independently of Buddhism, but approach is very similar, especially to the idea that our thoughts and perceptions shape our reality. It focuses on identifying inaccurate or negative thought patterns and behaviors and modifying them, providing space to clearly view challenging situations and respond more effectively rather than reacting reflexively. Proved useful in helping people address a wide range of psychological problems such as depression, anxiety disorders, phobias, OCD, obsessive compulsive disorder, PTSD, substance abuse, and bipolar disorders. Mindfulness in CBT is used to identify and address negative thought patterns, rather than simply observing thoughts without attachment or judgment, as in Buddhist practices. Mindfulness-based stress reduction, developed in the late 70s by John Kabat-Zinn, a Harvard molecular biologist who practiced Zen meditation. In his 8-week course, mindfulness-based stress reduction, initially for stress management, eventually adapted to also treat anxiety, depression, skin diseases, hypertension, diabetes, immune disorders, and pain as a non-pharmacological treatment for chronic illnesses. It emphasizes mindfulness, focusing on present moment awareness and non-judgmental observation. Practices taught include sitting meditation, body scanning, mindful movement, and other tools. A 2022 study for treatment of anxiety disorders found that participants in the 8-week mindfulness-based stress reduction program gained the same amount of symptom reduction as an antidepressant drugs. There have also been studies supporting the use of mindfulness-based stress reduction for PTSD. Mindfulness-based cognitive therapy, developed as a combination of CBT and mindfulness-based stress reduction, primarily to provide individuals with major depressive disorder resources needed to prevent relapses, incorporating meditation techniques to foster awareness and acceptance of thoughts and emotions, reflecting Buddhist principles of mindfulness and impermanence. Combination with CBT to identify the negative thought patterns that can trigger a major depressive episode, with mindfulness practices to help the individual separate themselves from their thoughts. Proven to be as effective as maintenance antidepressant treatment to maintain quality of life and preventing depressive relapses over a 24-month period. Studies have found the therapy to have a positive effect on addressing general anxiety disorder. Neurological effects of meditation. Scientific investigations have discovered neurotransmitter and hormonal effects of meditation, resulting in improved mental and physical effects, including serotonin, increasing the levels for a happier state of mind and improved mood. Cortisol, reduced levels, lowering stress and less physical wear and tear. DHEA, increased levels that have the ability to help increase longevity. GABA, increased levels help with calm and eased anxiety. Endorphins, increased levels reduce pain, cause euphoria. Growth hormone, increased levels are anti-aging. And melatonin, increased levels improve sleep. Cautions and contraindications. Meditation is not a one-size-fits-all. Different personality, body, and energy types do better with specific types of meditation training. It's best to have an experienced teacher skilled in meditation. For those with personal or family mental illness history, meditation may trigger a psychotic break. Meditation may release emotions and mental blockages from abuse and trauma, causing unprocessed grief, anxiety, and anger. Studies report uncomfortable kinesthetic sensations along with mild dissociation, guilt, psychosis, grandiosity, elation, destructive behavior, and even suicidal thoughts. One study found as many as 62.9 participants experienced adverse effects from meditation, including anxiety and panic attacks, increase in tension or confusion, feeling less motivated, boredom, pain, feeling spaced out, and an increase in negativity and feeling addicted to meditation. Insurance coverage. The foregoing secularized therapeutic methods may be considered medically necessary for treatments of various psychological problems, such as general anxiety disorder, PTSD, major depression, adjustment disorders, and borderline personality disorders. There is a valid CPT code, including 90832, 90834, 90837, and 90838, depending on time, if evaluation services are included. CPT codes are for the treatment of individuals, other codes for families and groups. Finally, it's a sad commentary on the modern healthcare system that ultimate validation and effectiveness of any therapy is whether the insurance company will reimburse for treatment.